He's gonna crack me like a glow stick. Oh, that one was good.
Hey guys, Dr. Eric Smith, downtown Chicago, Optimal Health Chiropractic. Today we're going to be taking care of Lauren and taking her through part of the Optimal Health Advantage that we have. So Lauren is in town today. I'm excited to be treating her because she's been flying around doing different things, and she was in Colorado for a while. One big thing with Lauren is I used to treat her back here in Chicago, and with her traveling, she does like to stop in so we can get her adjustments in.
He always takes care of me.
I always take care of her, exactly. So Lauren is very inspiring. She is obviously like into fitness, has a great physique.
Oh, stop it.
She works really hard, and she is inspiring and working with women of a wide variety of ages and she got lots of tips and different things. And so a lot of like that demographic, what are the bigger things that you've seen over the last few years that you've changed in your life that's made a big difference?
Well, I've actually recently just lost about 25 pounds, making a commitment to my health and my fitness. And guys, I look better, I feel better, so follow me if you want to do the same.
Yeah, so check out her Instagram. She has a lot of great tips, lots of inspirational stuff, and sometimes too I look at those like, man, that mindset that she has is really helpful. So
it's all in the mind, isn't it?
It is all in the mind.
He knows. He gets jacked too.
I do, yeah.
He's all about the gains.
Yeah,
bro.
we've seen each other in the gym here and there. So today we're going to help with that mind by taking care of her nervous system, which is really what chiropractic does. Is we're working on making sure the connections from the brain go to the body so the body can get feedback and to the brain so it can work in an optimal way possible. So some of the things that you'll see is with Lauren is that she actually has a small, actually not even small, because she showed me, I got the chance to see the x-ray. She has a good size scoliosis in her back. So that's a lateral curvature and rotation of the back.
Yeah.
Pretty.
My back's a little messed up.
She's an overachiever, and that's one more thing, that she's actually got that. So we're going to work on her. We did a little bit of an examination earlier, and I know her history, so I'm going to have her go ahead and lay face down, and then we're going to get to work on her, okay?
He's going to crack me like a glow stick.
Glow stick time. So, couple things with her that I always like to check out is taking a look and seeing what's going on with her feet and seeing if there's some type of rotation going on. And her feet are off, which is pretty normal for her. She's, how many days a week are you hitting the gym?
5 right now.
So what do you do?
Lifting heavy.
So what do you do on your rest days? Is it like an active recovery?
You know, it just depends. Sometimes I like to ride my bike and walk around, but sometimes I like to just be a couch potato and do nothing. What do you do on your rest days?
What I do on my rest days, I do morning cardio every day. I just go walk.
Oh my God, overachiever.
Every day. And then I also try to lift about 5, and then I just picked up doing some jiu-jitsu. So I'm going to do that to work on my mobility and flexibility while we continue to lift some weights. I'm going to have you scoot on the table just a little bit if you can. Cool.
Is that good?
Yeah, that's perfect. So we're going to do some what's called flexion distraction with her back. So with her, what I want to do is lengthen the spine so I can get the facets and such to open up a little bit. And the facets are the joints on the back of your spine that make it so when you lean back they actually catch and hold you up. You do not have facets on the front part of your spine. That's why we can bend forward. But with her, with the slight pressure that I'm putting, it's going to create this traction effect and open up these joints, so it's going to be a little bit easier to get some rotation and movement through her pelvis, and then we're going to get into her thoracic. So treatment of scoliosis is something that needs to be done not only by a chiropractor but by the patient. So what I mean by that is she's being active, working on her core, hitting the workouts that she needs to do, taking care of her nutrition, balancing herself by getting adequate rest, and also just being positive. So her muscles can be relaxed, she can strengthen her core to hold her spine in the center, make sure there's not further progression of those deviations, and as well as help with the correction of it. So one thing you'll see if you do have some type of scoliosis like that, if you work with the right people that work through what we do here with the Optimal Health Advantage, is not only adjustments, but we work on how you move and how the muscles work. And if you can change how you move, you can fix the defaulted pattern. So that's one thing that she's helping out with, because she's actively taking care of her health. So a lot of my patients wonder, like, hey doc, do I need to be coming in? How much do I need to come in? That really depends on how much you do. So with Lauren, she's very well aware that she's in control of her body, she's in control of her health, and she's doing quite a bit on her own to manage that. So that's why I get to see her here and there, and every time she comes in, she looks even more fit. So winning left and right.
Winning.
We are going to get into your adjustments. So let's do some easy ones to your thoracics first with this curve. Nice deep breath, please. All the way out. Good.
Oh yeah. Oh yeah.
Good job.
That was a good one.
You can definitely tell that your back, you've been doing some work with it.
Really?
Yeah.
That's awesome.
Before, the first couple times I had adjusted, I'm like, this poor woman, this small woman, and I got to use all this power, but I don't. She's been doing a lot to make sure her joints are healthy and moving, so it's really not a lot of force. It's just a little quick movement with her, so. Perfect.
Oh, that one was good.
So have you been getting, like, you've been meal prepping a lot, right?
Meal prep is the name of the game. Abs are made in the kitchen, people.
Abs are made in the kitchen. What are your favorite things you've been cooking lately?
You know, I'm kind of a creature of habit. I just like to make a bulk of like my proteins, my vegetables. But I have found some really good sauces lately that are sugar-free that I've just been really enjoying. I found a sugar-free teriyaki sauce, and it's like changed my prep life.
Uh-oh. Might have to swap adjustments for food.
Sounds good. That seems like a fair trade. I'd be into that.
When's the cookbook coming out?
Coming soon.
Coming soon. Nice. I'm pretty sore up here and here.
Always.
Okay. Put that here. Just relax. Good. Good job.
Oh yeah.
Good work. Before I get the middle part of your back, I'm going to check out her ankles. So she's been doing a lot of squats, lots of lunges, and a few other things. So I want to make sure that her ankles are moving well enough so it creates the correct movement in the knee, correct movement in the hip. A lot of times lower back pain and some of these other things can be really found by seeing the deficiency or the problems below. Because if you think about it, a house that has a foundation that's wrong, the roof's going to be wrong. So you want to kind of fix from the bottom up. So we're going to take a look at her ankles here and see what's going on. And it's been a while since you've had it's been a while since you've had your ankles worked on, right?
Yeah, I don't know if I've ever had my ankles worked on. This is a special day.
It's a special day. So
one lots of HIIT cardio too, so I feel like that's very intense on the legs.
What are you doing for your HIIT cardio? Like stairs or?
Stairs, treadmill. I mean, lately gyms have been closed, so just running outside, sprints, anything to get the heart rate up.
So what I'm feeling for, she can really move into what we call plantar flexion there, but dorsiflexion, she has a hard time. So I'm going to let this leg relax as much as possible.
Oh, wow. That's pretty great.
Good. So a lot of times what will happen is when she's doing all this HIIT cardio and her calves are pulling up on the foot and locking this in, there's not an easy way to just traction and get some movement in there. So now the foot will be able to move the way that it should on that joint. And then we're also going to just adjust her hips real quick. Let this relax. Good.
Oh.
Okay. All right, let me have you sit up.
Well,
of course you don't need my help, Miss Abs.
Feeling better already. This is amazing.
Okay, can you move your neck around a nice big circle for me?
Yes, I can.
Excellent.
It's amazing.
Well, I think, like, is there anything else that you're feeling restricted?
I'm feeling really great now.
Okay, cool.
Feeling very mobile. The world is my oyster now.
It is. So you should take a look at her information on her Instagram and all the other great things she have coming out. The world is her oyster, and she wants to express herself and as well as help other people, just like I've helped her. She's helped me and inspired a lot of things in other people in our office. So, like I said, take a look at that. And if you guys have any questions or have any issues going on with your spine that might relate to Lauren's, just please comment below, and we'd love to help you out.
Comment below.
See you
And
guys
come
later.
see this guy. He is awesome. He will make you feel amazing.
She's the best. See you guys.